We're thrilled to be joined by Stefan Timmermans, who's a professor of sociology at UCLA, with quite a range of really fascinating research interests, including medical sociology, science, health professions, medical technology, death and dying, and then population health. So we're very excited to have you join us and talk to us about the social autopsy. Thank you so much, Stefan.
So it's a tremendous pleasure to be here. Bonjour, mesdames et messieurs. Good morning, everyone. So I was talking a little bit with Alison earlier, and she said one of the goals of this talk series is to inspire researchers. And so I hope that I can contribute to this by giving you some ideas. What I'm going to talk about is not necessarily super original in the sense that we present a whole set of new ideas, but it's aimed to boost a particular methodological tool in the social science toolbox that I think has been a little bit underutilized and maybe can be used to a better effect. So this is sort of more like a boosting and inspirational talk. So it should fit beautifully into your series. And everything I will be talking about has been co-authored with Professor Pamela Prickett, who is at the University of Amsterdam. And if you're interested in what we're talking about, okay, yeah, here we go. The article that we are drawing from has been published online already in the Sociological Methods and Research, so you can find it there. Okay, so what is the social autopsy? The social autopsy takes a cluster of deaths that are similar and critically interrogates the social and political conditions that have generated these deaths. And the goal here is to create awareness about the social roots of these deaths, the social policies, the social embeddedness of social life that has contributed to these deaths, and then hopefully to also inform policy change. As I mentioned to you, it's not necessarily a completely novel or original idea. We can find lots of examples of this once you have this definition of social death in past social science research, like starting with one of the founders of sociology, Emil Durkheim, who asked why different groups. You find other markers of predecessors of the social autopsy. Du Bois talked about the differences in black and white mortality and explained them with structural factors. Engels wrote about the high mortality rates of the working poor and linked them to their exploitative working conditions. We also see cover terms for what could have been a social autopsy all around us. So the notion of excess deaths, which is very common right now in the context of the COVID epidemic, preventable deaths, premature deaths, terms like man-made disaster, lethal workplace accidents, assassination, suicide bomber, genocide, terrorism, fatal medical error, they all hide social processes. And one of the goals of the social autopsy is to bring these social processes to the foreground and, for example, critically interrogate why certain workplaces have lethal workplace accidents. What are the mechanisms by which they can be prevented, and why aren't these mechanisms working, since we have deaths occurring repeatedly in particular kinds of workplaces, in particular kinds of professions. So there are three kinds of autopsies that have been used, and actually there's two, and then the third one is the one that we're proposing here, the social autopsy. So the first one is the autopsy done in medicine. It's the opening of the body done in hospitals to explain a patient dying either prematurely or at time, and it's sort of mostly often presented as a detective story where the pathologist is going to settle what really happened to the patient. It's also common in a forensic setting where coroners, medical examiners trained as forensic pathologists or rely on forensic pathologists to explain deaths that occur in suspicious circumstances. And I've written about this. I did an ethnography of a medical examiner's office. I observed these kind of autopsies. So I'm going to contrast the social autopsy a bit with the autopsy in a forensic setting. Then we have the psychological autopsy, which has a little bit more of a submerged existence. It's not as common as the autopsy done in medicine. It's basically being used in cases where there is ambiguity on whether a suicide may have occurred or not. And people hire a psychologist or psychiatrist to interview the close relatives to get an idea of the mindset of the person who passed away, and sort of get to see where they were psychologically and whether a death due to suicide is more likely or not. And then there's the third one, the social autopsy that I will use, but I will contrast particularly number 1 and number 3. Okay, so let's go to the autopsy in forensics. So one of the striking things as a social scientist observing forensic pathologists autopsying dead bodies is that so many of the deaths are attributed to coronary artery disease, to heart disease. And you have to keep in mind that forensic pathologists can only take jurisdiction over dead bodies when they fulfill certain kind of criteria, when they occur in suspicious circumstances. And so there's a suspicion of suicide, of homicide, of accidental death, but even then, quite often, quite regularly, they would find coronary artery disease. And my argument, the argument that I make in one of the first chapters of my book, is that this reflects the kind of the professional skill set that forensic pathologists bring to the death investigation. What they're doing is just very compatible with finding heart disease. So during an actual autopsy, a pathologist will make a Y incision, open up the body, take out the rib cage, and then look at the organs to figure out whether there's a cause of death. And they remove the organs one by one, weigh them, they take blood, and they turn this into numbers, which is a process we're very familiar with from Bruno Latour in science study, this kind of quantification and how you reduce properties, social context in order to quantify them. Their definition in forensic pathology of death is the cessation of electrochemical intercellular communication, but they come at a moment where this process is completely grinded to a halt. There is no more communication happening, or if there's a new communication, it tends to obfuscate the cause of death because it's the communication due to decomposition. So when they are looking at the body, their definition of death doesn't necessarily give them a lot of leverage on coming to a cause. And so what they do during the autopsy, their default is they take the heart and start slicing very precisely the coronary arteries and then open them with their thumbs, gloved thumbs. And often they find what you see here on the picture, they find an occlusion in one of the coronary arteries. So this atherosclerosis, and this structural evidence is sufficient as a cause of death. It fits on the cause of death form. It's easily measurable. You can take pictures. They have one-on-one cameras that just, whatever you see on the camera was how it was in real life. So they really show the occlusion. It's ubiquitous. Almost everyone has it. And most importantly, it's a self-sufficient cause. You don't need much more. So if you're trying to solve the mystery of why somebody died, you do an autopsy in a medical context. This cardiac aspect is very rewarding because it gives you a default cause if toxicology or anything else doesn't come up. So one of the reasons why forensic pathologists find so much heart disease is that it's very compatible with the kind of skill set they bring to the body. They are not as good at finding multi-organ interactions or observing those, but they are very good at finding structural issues. And one of the most common structural problems is this occlusion of the artery, and it's conclusive. So what that brings to, what that reminds us of is the kind of disciplinary perspectives and how they produce particular kinds of knowledge. Like, why do we have forensic pathologists determine the cause of death in cases where people die under suspicious circumstances? And why don't we, for example, not have social workers do this or psychologists? Well, the fact that we delegate this to people with biomedical training, it produces particular kinds of stories, particular kind of causality stories about how death occurs and what kills people. And this is consequential. This is consequential in the sense that since one of the tasks that forensic pathologists have to execute is to differentiate between a suicide, a homicide, a natural and accidental death, which are the manner of death categories. The fact that they are so much relying on this cardiac disease as their default cause of death will mean that some deaths that are sort of wavering between natural and homicide might tip over into the natural death category. And it's not binding, whatever medical forensic pathologists say, it's not binding for the criminal justice system, but it sort of provides a little bit of a barrier if you think there's somebody died due to a homicide, and in fact the forensic pathologist comes in and says, no, look at the heart, look at these occlusions. It obviously was heart disease. It also has consequences for public health. Public health officials have long suspected that there is underreporting of suicide, but they don't really have the resources and the time to go in and do their independent investigation of every person who dies and determine whether they died due to suicide or not. They have to rely on the kind of evidence produced and the kind of classifications produced by forensic pathologists. So it's also consequential in the sense that the autopsy in a forensic and a medical setting tends to individualize and biomedicalize the explanation for death. So over the history of forensic pathology, there have been a few structural changes, a few instances of advocacy, but it's very rare. One example that I remember from the beginning of the 20th, I wasn't there, but I read about it, in the beginning of the 20th century, was a forensic pathologist or a coroner actually in New York City, who was very perturbed by the fact that so many people came in killed by cars because trams would disembark people in the middle of the street. So the tracks would go in the middle of the street rather than at the sidewalk as it's now. And so he made a big deal out of this, and eventually legislation was changed that if you have a tram stop, it needs to end up at the sidewalk rather than in the middle of the street. And so that's one of the very few instances where they take these deaths and turn it into sort of more of a public cause. But most of the time, coroners and medical examiners, they're so overworked and they're so under-resourced, they focus on the here and now, on processing bodies, and offer individualized explanation that locate that either in some behavior or risk factors, but most likely in the pathology of the body. So the question then is, are alternatives possible? And you wouldn't be in this talk if I didn't have a yes answer to that. Indeed, there is also the social autopsy, which turns outward rather than inward. So turns in rather than turning into the body and looking at the organs and following traces of bullets through organs, or looking at toxicology and then implementing that in sort of imagining the effect of toxic levels into a death scene investigation. We turn outward. We go to much more remote social factors that might explain these clusters of death. And the big challenge, and I just want to throw that up front, and that is particularly striking in contrast to what I just talked to you about in terms of the forensic autopsy, the challenge is that the closer you get to death, the more certain your causality. So if you look at these occlusions in the coronary arteries, you're basically almost attesting to that. You're not explaining very, very much. You're pointing to something. And there are lots of people who die from from bullet wounds to the head, and they still look at the arteries, and the arteries are occluded as well. But still, it counts as a self-sufficient cause of death. So the closer you stay to the moment of death or to the physiological sequence that leads to death, the stronger and the more confident you can be about your explanation, but the less relevant the explanation is going to be. So the farther you go, which will happen with the social autopsy, you're going to probably provide much more relevant causal stories and much more striking causal stories, but to make these causal connections is going to be much more challenging. So this is the kind of issue to grapple with. So in the article, we lay out 3 steps for conducting a social autopsy. And the first one is the question of sampling. Which deaths should you take? I mean, people die all the time. You cannot just conduct a social autopsy of each one of them. So you probably have to be selective. And here we sort of have a little bit of a cop-out criteria, but it's just, this is what it comes down to, is that you basically have to select somewhat on anticipated social relevance of these deaths. So you need to select the cases on analytical grounds rather than even on frequency or on or either as being very rare or very common. And there's some ways that you can sort of enhance or get some indications of social relevance. One is you can focus on very visible deaths, ones that make the front page of the newspaper, and I'll give you an example later in the talk. Or you can focus on hidden deaths. So in many situations, people dying are they're folded into other categories, or they're folded into other procedures, bureaucratically, politically, they're made invisible, rendered invisible. Actually, deaths of native people are often rendered invisible, and both historically and institutionally. And so to bring those into the limelight and doing research around this and trying to explain both the process that causes these deaths and then their disappearance is in itself a contribution. And based on what I just mentioned to you in terms of the forensic autopsy, it's really important to be critical of official classifications. And for instance, the category of SIDS, sudden infant death syndrome, it basically, you need to know how a pathologist or a social worker determines that the death is due to SIDS, or a police officer determines that the death is due to SIDS. It basically means that we don't know what caused the death, but the baby died. And so we have looked at all plausible factors. We don't come up with anything that sticks out. So this is a residual category. And so you need to understand under which kind of conditions this occurs. And maybe a contribution of the research would be to take the infant deaths and slice them differently away from these official classifications in ways that make sense on social grounds, on theoretical grounds. So the first step is about sampling. The second step is where to look for explanations. So a social autopsy, rather than turning inward into the organs and the biochemical processes, turns outward into social mechanisms, social processes. And so here you have to look for social worlds, how people are embedded in social worlds, and which ones of these worlds are going to be the most relevant and salient to look across patterns, across the cluster of deaths, are going to give you the most explanatory value. Now, in the case of death, that sounds easier than it is in reality, because a lot of people die in social isolation. So the question is actually not like where are they embedded in, but it becomes almost like where could they have been embedded in, but are no longer embedded in, and what is the process by which they estranged or became socially isolated. The idea is to look at downstream social factors, which brings me to step 3, which is this idea that I already mentioned. Is the Achilles heel of this approach is how to establish causality. And I'm exaggerating it a little bit because, of course, social scientists have thought long and hard about causality, and we have lots of ideas around case comparisons. There's an extensive literature that you can bring to bear on the social autopsy, and in that respect is not that much different from other social science. But because the contrast is with other kinds of autopsies, it can be more of an issue. I am very partial to Bruce Link and Joe Phelan's work on the fundamental causes of disease approach. And this goes a little bit beyond the scope of the talk, but I just want to give you a flavor of this. Basically, what they're trying to do is to try to explain why do we have persistent health inequities across a whole bunch of diseases, across a whole bunch of social groups, and across time. They just keep going on and on and on, and they keep repeated. We get new technologies, we get new medications, we get new disease categories, and every time we see this gradient of people doing much better than other people. And so what they argue is that rather than looking at the immediate risk factors, which is the approach in public health, we need to think of what put people at risk for those risk factors. What are the underlying fundamental causes that explain this? And one of them they propose, and that I think also works in the context of the social autopsy, is social class. So they say, if you look at how social class is related to a whole bunch of health outcomes through multiple mechanisms. And if you take a bunch of these mechanisms away, it doesn't necessarily solve the problem, because you can have new mechanisms occur. So it explains a lot of health outcomes and health disparities through many, many different kinds of mechanisms. And so this kind of thinking, I think, has some important lessons for establishing causality in the social autopsy. Because we're working in a contested field, this last question about how the social explanation you come up with relate to other explanations also bears attention, because often people aren't waiting for a social scientist to come in and explain a bunch of deaths. There's going to be a number of explanations already in the media, among politicians, being promoted. And so the question is like, why? You also have to look at these alternative explanations and see how they impact the kind of explanation you bring forth. And I'll explain that in just a second. Because the book that really puts the social autopsy on the map was a book by Eric Kleinenberg, professor at NYU, who wrote his PhD dissertation about the 1995 heat wave in Chicago. And I thought this is going to be, I liked that book quite a bit when it came out, and I thought, oh, everyone is going to do social autopsies. But then, of course, not everyone did social autopsies. If actually the literature on social autopsies is pretty skinny. We could have a big party in my office with everyone who has done that and have room to move around. So that's one of the reasons that I'm sort of trying to boost this approach with the article that we just wrote. So basically what happened in Chicago in 1995, a heat wave, temperatures reached 106 degrees Fahrenheit, more than 700 people died attributed to heat-related deaths. Hospitals were inundated. The local medical examiner, their morgue was overflowing, and so they actually had to get meatpacking trucks to store dead bodies because they were so overwhelmed. Very quickly, a narrative emerged about what did these people die of. And on the one hand, there was a narrative of pathology, the comorbidities story. These were weak people, they were vulnerable people, or the alternative was they died in unprecedented natural event. This was the heat wave of the decade, the heat wave of the century, and nobody could have prepared for it. So Eric then does the social autopsy, where he's going to look at various social factors. And he doesn't do exactly what we write in the article, but some of it overlaps. So first of all, he's going to look for patterns. He's going to ask who is more likely to die than others. And so the normal death rate was about 62 people dying in Chicago on a daily basis, but during the heat wave, it came up to 365. And as you already can see here on the map, these deaths were clustered in neighborhoods that we also know are neighborhoods with high poverty, high infant mortality, high deaths due to violence. So there's some kind of patterning there that is occurring. deaths due to the heat wave are occurring more in impoverished, high crime neighborhoods. They're involving more men than women, more blacks than whites, Latinos, more elderly than young people. Okay, so then we're looking at embedded social worlds. And so one of the really interesting arguments that Eric makes is that it isn't necessarily just about socioeconomic status of the neighborhood. He compares two neighborhoods, South and North Lawndale, one of which is a neighborhood that is basically sort of, the archetypical image, and he has some pictures of it in the book. It's like almost feels like a bombed out neighborhood. There's these isolated buildings, boarded up. And basically people live there, but they're afraid. They have bars on the windows. They don't venture outside. There's a lot of social isolation. And then you have another neighborhood that is socioeconomically quite similar in the sense that people there are very poor, but it's a very densely populated neighborhood with 3-generation households. And there's lots more caretaking. There's much more social capital among the residents, and it has a spillover effect. They look out for one another. So he explains some of the differences between these two, the death rates which was much higher in the first neighborhood than in the second neighborhood, by the social isolation of the residents. And there's some questions you can ask in terms of causality or whether he makes a convincing case, but it definitely it's provocative in the way that he teases that out. He also looks at the kind of policies that have been done in terms of taking care of the poor and indigent residents in these neighborhoods or in Chicago in general. And what he finds is a consistent theme of entrenchment of social services by the police department, the fire department, and these other departments that I have up here. And the story is across these agencies is one of downsizing of social services, outsourcing and privatization, and fragmentation of the social services. And there's an ethos where it becomes people's personal responsibility. People should take personal responsibility for their health and well-being. They should get jobs, and they should just take care of themselves. And we see a resonance of that in the United States, in the COVID response right now as well. This is the idea of this personal responsibility. And then we see also the privatization and fragmentation of social service programs. And he argues that this also contributes to this higher death rates, because whatever safety net was at one point in place is completely frayed to the point that it's ineffective. And then there's an official framing of the story. And that's because Eric is also interested in the media presentation. He pays quite a lot of attention to this. Is sort of like that bottom slide. It's like, how does your explanation compare to alternative explanations? And he says he's interested in how does a narrative about this event crystallize as a causal narrative. And there was a lot of political sensitivity about that's attributed to a natural event, a heat wave, because a previous mayor had lost his re-election bid due to a blizzard that was mishandled and people were stuck in their houses. So what you see then in the official response, and Eric maps this, is first denying that people died, then when it could no longer be denied. And actually the reason why it couldn't be denied was in part because the medical examiner invited the press to his facility and showed all the meat trucks, and so it was kind of difficult to argue that people aren't dying. Then there was like a second move of blaming the victims, blaming electric power companies, blaming the water companies, and then eventually it was just a natural disaster. The politicians presented this as a natural disaster, and Eric traces how this becomes like a self-fulfilling narrative that is being taken up in the media as well. So when I was thinking about this talk, I want to give you another example that is less worked out and that is just sort of more like a thought experiment. When I was thinking about this talk, we had this big fire on Sunday in the Bronx where 17 residents died, and many of them were Gambian immigrants. And here you see the fire in the apartment, and you see the firefighter, which the picture that is all over the more conservative media. So let's say that you're interested in doing a social autopsy here. And so I want to give you some clues of where to go or where to start with. So you want to first look at how quickly there is kind of a media narrative that singles out two factors that explain these very tragic deaths. First of all, people focus on the fact that the apartment where the fire started, there was a space heater, was being warmed by a space heater, and the space heater might have caused the fire. Secondly, they focus on the fact that the doors were faulty. So the doors of that apartment had been left open, which created this flue effect, bringing lots of oxygen to the fire, creating more smoke. So they created very favorable conditions for the fire. So both the door and the space heater were being brought up as alternative explanations. So the question you can ask then, why does the building not have self-closing doors, which was required in 2018? And this is all gathered from a whole bunch of Twitter and media resources. So between 2013 and 2019, the building was cited 6 times for the fact that these doors were not closing as they were required, but it could take up to 3 years to fix it. There were no outside fire escapes because older buildings were exempt, and the residents were kind of immune to fire alarms because they heard them 5-6 times a day, and so they sort of like brushed it off. There were smoke detectors were malfunctioning. There were no sprinklers. Now, each one of those bullet points, they have a history behind it, and you can trace back the history. Was why are there no fire escapes on older buildings? What's the history behind that? And then you can look at the convergence of all these particular factors and see how much that explains by looking at other buildings and other policies of why this fire was so lethal. So why did they use space heaters? So here, this is an actual record of this building, of complaints that were launched with the housing authority, and it was only of 5 apartments. But what you can see over and over again, no heat, no heat. There's like 3 or 4, no heat, hot wire, no heat. So the building wasn't heated, and at the time of this fire, the outside temperature was right under freezing. Not as cold as where you guys are, but pretty cold. So then you can ask, why don't the residents move? They had Section 8 housing, but their vouchers were also not transferable. Again, there's a history behind this. We know, let me just move ahead here. We know from Matt Desmond's work on eviction that there is most housing profit in the poorest neighborhood. And so this building had been sold only 3 or 4 years ago, and the government had provided subsidies to keep it low-income housing, but there was not really a system of making sure that the subsidies were used for their intended purposes. So again, there's a story here about governance, outsourcing, and then the Gambian migrants. I think that's a different kind of story. I don't know where to go with it, but the fact that they were all Gambian migrants might also give you some clues of how to conduct a social autopsy. So the idea here is that you go outward. Oh yes, I forgot about this slide here. So some researchers have done some preliminary data analysis and shown that from the top 10 New York County community districts with the most multi-unit residential fires, 6 of them were in the Bronx. So there's a geographical story here to tell as well. And over time, African Americans or Black immigrants make out 13% of the residents, but 5% of fire fatalities in New York. And this is a consistent historical pattern. So you get, the more you dig into it, there's a story starting to form, and I don't have that ready for you at this point, but there are clues here that you can develop and research and investigate in order to come up with a story about why this is not a random tragic occurrence. This is kind of a systemic outcome of a whole set of policies that converge and produce this kind of these deaths. So to wrap this up, the social autopsy looks at the social political determinants of mortality. You look for patterns, you explain variation, and you look at for more distant causes rather than the ones that are right, obvious in the body or the death scene. And as clear, this is not, like any kind of autopsy. This is itself a political project which will highlight one reality over another. But I think there's a merit in highlighting these kinds of realities. That's it.
Thank you so much. Questions, comments?
Thoughts?
Feel free to just speak up or put it in chat if you'd like.
Is anybody of you doing research that sort of falls under or could fall under the social autopsy umbrella, broadly speaking?
I am. We do a lot of applied research at Spark, and one of our clients works with people that are have substance use issues, and then also other sort of strong indicators of death. And so a number of clients die. That's a very common experience within the program. And so as you were talking about this, I was thinking about the implications of that, because many of the people engaged in this program have been repeatedly failed by structures and social services again and again and again.
Yeah, and I think there's something, so we know, this is one of the substance abuse deaths. That's one of the areas where there's actually a lot of social autopsy adjacent kind of research already being done by investigative journalists and by social scientists. So I think that actually is a very good target for or subject for a social autopsy.
Others? I'm curious what drew people to this talk today.
I'm usually not that intimidating.
I think it may have much more to do with beginning of the term and early morning.
Interesting the topic, good. Well, so the goal is to just inspire you to sort of think about this. I think actually this, just if I can riff a little bit more, so one of the things that is happening now in the Bronx is that at the funerals, there's this call to action. And so I think that's another part. That's not the social autopsy, but it's another way in which deaths have something about, there's something about deaths that can galvanize social action. And of course, we saw that in the Black Lives Matter movement. We saw that very powerfully there, but there's something I think that is also worth looking at from a social science perspective. Is like, how much does death galvanize action, and what kind of forms and does that take in the end? Because, some of the ideas that I just threw at you, they're also being, we're not the only ones who are aware of them. There's other people who are picking them up, or not necessarily in the same way, but they're sort of trying to do something about it. So I'm interested in how death motivates people to do something, how that is a spark, to use your word, spark for social action.
Okay, we've got a couple of comments, but first I just want to say, when I finished grad school, I went into a foundation that provided consulting to juvenile justice and child welfare systems. And the thing that we learned was that no one was really interested in free consulting until there were child deaths. As soon as there were child deaths and deep media scrutiny on the system, we would get people deeply committed, and we would get systems implementing massive changes. But we got to the point of recognizing that death is the motivator, and you can't institute systems change. You simply don't have the motivation unless that's happened.
Yeah. No, I would imagine that's indeed the case in a child welfare system.
Lindsay, you say, I'm interested in the relevance of this to COVID pandemic. Are you aware of applications within the pandemic context?
So the person I started with, Eric Kleinenberg, is writing a book about, is writing a social autopsy book about the COVID pandemic. I think, so you almost have to slice the COVID epidemic in different time periods and then almost do independent social autopsies. Because, you know, there was the pre-vaccination, pre-testing period there, you know, and that created particular kind of risk factors for essential workers who were, you know, exposed to everything. Then you had the vaccination period where now it becomes much more politicized, particularly in the United States, becomes much more politicized. So you have a different kind of social configuration and social set of risk factors. And then right now we have this basically, you know, everyone can get affected kind of situation, but, you know, there is mortality, but it's not as clear cut what the pattern is, except for the unvaccinated. So I think there are multiple ways in which you could do an COVID-based kind of social autopsy. And even though, and actually also like Canada, United States, but then also globally, you know, so you can sort of do, this would be a very good global application of the social autopsy, and sort of look at the resources, how they traveled at different points and how they made or didn't make a difference across the globe. But Eric is sort of, I think he has been pretty cagey about what he's doing there, but I think it's, you know, he is going to focus again on his theme of social isolation and social cohesion, because he sort of almost tends to gravitate to that, which you do get a lot of leverage out there, out of that. But if other people have other ideas of how you could take the social autopsy notion and apply it to COVID, feel free to chime in.
Okay, Mohammed's just commenting about sort of the tendency to label things individual accidents, to treat things without causal context and broader social context. And I would add to that, in many ways, that's sort of a natural human reaction, is to atomize.
Yeah, I think it actually is even stronger in the cases of death, though. You know, I think there's, so I've been thinking a little bit about that as well. It's like this denial of death, sort of, I'm not sure whether it's like a culture, but it's definitely a presence where, you know, you can point to many efforts, even just the forensic system, that we invest enormous amounts of resources in trying to explain something and fold it into explanatory categories. And the message here is that it should provide you with some kind of reassurance, with some kind of solace, that the death is understandable, that it is not random, that it is not something that is, it can be unjust, but even then it's understandable. So I think that there's something about that. You know, when you do a social autopsy, you're asking uncomfortable questions, or you're bringing up uncomfortable factors, which is probably also one of the reasons that it hasn't really taken on as much as maybe I hoped it would have taken off, because it's much more reassuring to think about the heat wave as a once in a century exceptional event, even though by now we already know that it's no longer the case, that is not the case, and probably was never the case. But just that kind of narrative provides people with reassurance that you could have fans or you know, cooling centers for elderly people and solve the problem that particular way, rather than thinking about more structural changes, or rather than accepting just the mortality of everyone. You know, that idea that eventually there is going to be a way that everyone was going to die.
Luca has a comment about being interested in the kinds of methodologies that fit under social autopsy, that help to sort of build that evidence base and that causality, and the sense that ethnography seems to be a natural fit.
Well, as an ethnographer myself, I would say absolutely yes. to that. But I think you can also do this for quantity as a quantitative researcher. The issue with a quantitative researcher is the one that you're very dependent on official classifications. So I have my colleague to the right of me, Patrick Heuvelin. He spent a very large part of his career trying to calculate how many Cambodians died under the Khmer Rouge regime. And, there's like a very sophisticated kind of methodology and population projections, and they come up with a number that's in the millions. But that's as far, that in itself is an extraordinary achievement because of the, the way that these deaths were literally made to disappear in killing fields. So you can do this also quantitatively, and I think there's lots of room to do this. But from a qualitative perspective, there's ways that you can observe these social mechanisms, almost the way they play out right in front of you by, talking to social workers, talking to the people who are supposed to be taking care of, especially the frontline workers, supposed to, in criminal justice, in education, in the medical system, that are supposed to take care of safety nets and vulnerabilities, and ask them about the gaps in it, and then put it together and see how these factors play out. So I do think it is very ethnography is a good fit for the social autopsy, and Eric Kleinenberg did ethnographic research. I present that research as if it's unproblematic. It actually is it's controversial in certain circles for many different reasons, including for methodological reasons. There have been several debates around that book on the heat wave, and it goes beyond what we're talking about. But I do think that there are ways in which you can ethnographically study these deaths and get to a lot of very rich and deep insights about how the social mechanisms through which these deaths get produced.
All right, we are just about at time. Thank you all so much. And thank you, Stefan. This has been a fascinating conversation.
You're very welcome. Enjoy the rest of your day, your weekend.
Take care, everyone. Bye.
Thank you.